So ladies and gentlemen, good afternoon. So first of all, I would like to thank the organizers for the invitation. Thank you very much. So today I will focus my presentation on high intensity and resistance training in young athletes. So I would like firstly to define what means resistance training or weight or strength training. So it's very different from powerlifting, bodybuilding, weightlifting. It's totally different. And resistance training can be defined as any regular program of exercises providing resistance to enhance muscle strength, muscle power, or athletic performance. And the methods include progressive exercises using body mass, such as push-ups, pull-ups, or free weights, or weight machines, such as the bench press, such as the leg press, or the chest press, etc. And children or pre-adolescent generally refer to girls and boys prior the puberty, prior to the development of secondary sex characteristics, defined as up to the age of 11 years for girls and up to the age of 13 years for boys. So when we speak about resistance training in young athletes, two main questions are generally asked. The first one is it effective and useful before puberty to improve muscle strength and muscle power and athletic performance? And the second one, is it safe and a bit risky in young children? So I will try to respond to these two questions throughout my presentation. So the actual position is different from the 70s, from the 80s, the 90s, sorry. And the position throughout years changed considerably from the 70s until now. So during the 70s, resistance training was considered as ineffective and unsafe in young people because of their insufficient levels of circulating androgens to induce muscle hypertrophy. So now at present, resistance training is considered differently and is considered now as essential to develop strength, power, and athletic performance, and now it should be incorporated in any planned youth sports training programs. So this actual position is defended by all the learned societies. All of them have recently refuted early claims that resistance training was ineffective in young athletes. For example, you have the Canadian Society for Exercise Physiology, the British Association of Exercise and Sports Sciences, BASES, the American College of Sports Medicine, the ACSM, the American Academy of Pediatrics, Council on Sports Medicine and Fitness, and the Strength and Conditioning American Association. So here is a recent representative example showing the effectiveness of resistance training in young athletes. In this study, published by Granache in 2011, a prepubertal children group aged 8 to 9 years underwent a resistance training program on different machines, leg press, adductor machine, seated calf raise machine, and using Swiss ball. And the duration of this program was 10 weeks at a frequency of 2 sessions per week. And the training sessions consisted of performing 3 sets of 10 to 12 repetitions against a load corresponding to 80% of 1 RM. And the second group served as control. It was of similar age. So the results showed that the MVC torque of knee extensors can be improved after the training program by 19% at a constant velocity of 60 degrees per second and by 17% at a constant velocity of 180 degrees per second, while no significant change was observed for the control group, either for 60 degrees per second or at 180 degrees per second. And similar results were obtained for the MVC torque of flexors. You can observe an improvement in muscle strength by 13% at a constant velocity of 60 degrees per second, an improvement of 12% at a constant velocity of 180 degrees per second. So another representative example published by Ramsey in 1990 and showing that after 20 weeks of high-intensity resistance training in prepubertal children, you can observe higher strength gains. For example, an improvement of muscle strength by about 35% on bench press, an improvement of about 22% on leg press, an improvement of 60% for elbow flexors, etc. So the duration of the program is very important for the gains in the muscle strength for a resistance training program in prepubertal children. So now, what are the main mechanisms explaining strength gains after a resistance training program in prepubertal children and adults? So the mechanisms are different. In prepubertal children, the strength gains are mainly attributed to nervous mechanisms and less to muscle factors. Whereas in adults, strength gains are related to both muscle factors and nervous factors. As shown by Granache in 2011, you can observe that it's very difficult to improve muscle mass and to induce muscle hypertrophy before puberty in children. As you can see in this slide, no significant change was observed for the soft lean mass of the leg after the program, or no significant change for the muscle quadriceps cross-sectional area after the program for this group after 10 weeks of resistance training, and no significant change was observed for the control group too. So it's very difficult to induce muscle hypertrophy before puberty because of their insufficient level of circulating androgens. In contrast, it's possible to increase muscle strength after resistance training in prepubertal children by specific adaptation in the excitation-contraction coupling. Because in this study, the twitch torque of knee extensors increased without muscle hypertrophy after 10 weeks or 20 weeks of resistance training in boys aged 9 to 11 years, and suggesting specific adaptation in the excitation contraction coupling or specific adaptation in muscle properties. Regarding the nervous mechanisms, it's possible to increase the level of voluntary activation after a resistance training program in prepubertal children, because in this study you can observe after the program that the voluntary activation of knee extensors increased significantly from 80 to 90%. So you can observe an improvement of about 10% in the level of voluntary activation in the level of motor unit recruitment. Another potential nervous mechanisms could be involved in strength gain after a resistance program. Probably it could be a better synchronization of motor units. It's possible to have an improved motor skills coordination or a reduced muscle coactivation. So it's possible, so further studies are required to check if these three hypotheses occur after a resistance training program in young children. So to respond to the second question about the safety of resistance training, here is the study by Hamil conducted in 1994 on the prevalence of injuries in children for different activities. And you can observe on this slide that resistance training or weightlifting are very safe activities compared to rugby, compared to basketball, athletics, physical education, tennis. So we can consider that these two types of training are very safe in young people. So two main reasons could explain the relative safety of resistance training in young people. The first one is that resistance training is commonly instructed and supervised by qualified professionals who have experience working with young people, and generally the coach to participant ratio is relatively high for this kind of training. And the second reason could be that the skills are generally learned with light or easy weights, since the first training sessions are mainly directed toward the development of a proper technique. It is also worth noting that children experience lower fatigability rates than adults during intermittent resistant exercise. In this study, Fagenbaum et al. In 2008 showed that the boys and the teens are able to maintain easier their lifting performance on a bench press during 3 sets with a 10 repetition maximum load with 1, 2, or 3 minute recovery intervals. You can observe in this study that the number of repetitions is significantly higher in the boys and the teens compared as the men, whatever the recovery intervals between the repetitions. We showed exactly the same results on bicycle, and we studied in 2002 the time course of peak power output during a set of 10 cycling 10-second sprints separated by 30 seconds recovery intervals. And you can observe that in the prepubertal boys, the peak power output or the cycling peak power can be maintained from the first to the last sprint in the prepubertal children. You can observe no significant fatigue in this population. Whereas for the teens, you can observe a decrement of the peak power output from the first to the last sprints, a decrement by about 20%. And in the men, this decrement is higher. You can observe a decrement of about 29%. So children fatigue less than adults during high-intensity intermittent exercise. You observed the same results on a non-motorized treadmill. Prepubertal children and adults performed a set of 10 treadmill 10-second sprints separated by 15 seconds recovery intervals. We measured during each sprint the mean power output, and we showed that the decrement was significantly lesser in the boys, minus 29%, versus minus 47% in adults. So children are able to maintain easier their running peak performance during high-intensity intermittent exercise than adults. So we ascribed the lower fatigability of children by faster recovery speeds in children. We analyzed the resynthesis of phosphocreatine following high-intensity exercise in prepubertal boys and in the men. And we showed that the rate of phosphocreatine resynthesis is significantly higher in the boys as compared with the men. The resynthesis is twofold higher in the boys as compared with the men. And it's the same thing for the muscle oxidative capacity. The children rely more on oxidative process during exercise compared to the men. The muscle oxidative capacity is clearly higher in the boys as compared with the men. So the lower fatigability of children during intermittent resistance exercise could be explained by their faster phosphocreatine recovery speed between each exercise, and this finding could be related to their muscle oxidative capacity. So in this slide, you can observe that this muscle oxidative capacity, named Vmax, decreases mainly during growth and less during aging. So the alteration of muscle oxidative capacity occurs mainly during growth and less during aging. And therefore, the recovery abilities decrease mainly during growth and less during aging, so notably during puberty. Another important point is that children experience higher removal rates of hydrogen ions following high-intensity exercise compared with adults. You can observe, following high-intensity exercise, that the muscle pH recover faster in the boys as compared with the men, mainly during the first minutes of recovery. So children eliminate faster their hydrogen ions from their muscles than adults following high-intensity exercise. And this could preserve better the muscles of children as compared with the men. So the lower fatigability of children during intermittent resistant exercise could be also explained by the higher hydrogen ions removal rates between each exercise. Another important point is that children experience lower muscle damage than adults following eccentric exercise or following plyometric exercise. You can observe in this slide that children experience lower serum creatine kinase concentration, which is a damage index compared with adults. Following eccentric exercise, there is a lower accumulation of creatine kinase concentration in the children as compared with the men. So children may experience lower muscle damage because of their higher tendinous compliance, which could act as a mechanical buffer and protecting the muscle from any extensive damage and fatigability. And the second hypothesis is that children have a lower fast twitch muscle fibers than adults. So the lower muscle damage in children could be explained by their greater reliance on slow twitch muscle fibers, which could be less sensitive to damage than fast twitch muscle fibers. So you can observe in this slide that the proportion of type 1 fibers is significantly higher before puberty compared with adults. So to avoid any risks of injuries in prepubertal children, we need to respect some practical recommendations. And the first one is the following. It's very important to avoid any maximal load, mainly above the spine. The second one is we need to promote an appropriate technique using light or moderate loads to avoid any injuries. For example, we can use 50% or 60% of 1 RM. Furthermore, the muscular development should be symmetrical to ensure an appropriate muscle balance around joints and between segments to respect the balance. Exercises strengthening the core musculature should be incorporated into the training programs. We need to ensure a sufficient recovery duration between sessions, and to avoid any consecutive resistance training session, we need to respect a recovery, duration of recovery between each training session. And it's very important, training session should be instructed and supervised by qualified professionals who have experience working with young people. It's very important. So in summary, we can say that resistance training before puberty is effective to improve muscle strength, to improve muscle power, and to improve the athletic performance. So there is a little or no muscle hypertrophy in prepubertal children. It's difficult to induce muscle hypertrophy, and the adaptation are mainly in the excitation-contraction coupling, or by nervous adaptations by an increased motor units recruitment. And there are low risks of injuries induced by resistance training, provided that guidelines are well respected. So resistance training should be designed to develop the core musculature in young athletes, and resistance training is essential in any development program for athletic performance in young athletes and should be considered as part of a planned youth sport program. Yeah. Resistance training should not be a proxy method to the main sport of the athletes. So in conclusion, during childhood, training sessions should be directed toward the development of muscle coordination by using multi-joint exercises. It's very important during the development of children, during growth and maturation. The development of power and strength by using weight training, resistance training. The endurance is very important before puberty and during puberty by using aerobic training and intermittent exercise to involve children in the different activities. And we need also to develop the speed by using short burst activities. So thank you so much for your attention.